it just starts to sink in how serious this is. And we went from a back injury to kidney stone to make some calls to your kids.
So Friday, September 30th, exciting day for me. At least it started out that way. I had just met with some friends and some customers, colleagues. We all got together that morning just to talk about retirement. There was a few of us getting ready to leave the business, myself after 36 years, so pretty exciting day. On my way out to the car, getting close to the car, I felt a little like a pull or a tear, like a muscle in my left hip. And I said, wow, that was unusual. And I said, well, I had a crash on a mountain bike a few days ago, and I walked away from it, so that was all good. But then, as I started to get closer to the car, the pain started to intensify a little bit. I said, wow, there's something here. So I tried to walk it off a little. I said, well, maybe I'll sit down before I go back into work. So that's when I called Tracy.
I barely could hear him, very faint. And he was saying, that something wasn't right. He had a pain in his back, and that he thought he needed to get to the hospital.
I've never felt pain like that in my life. It was just unbelievable. So, get to the hospital. I walked through the doors, they opened. I was met by a gentleman there. He asked me if he could get me a wheelchair if I needed some help. And I said, yeah, I really could use some help. He got me a wheelchair. There was a line there. He called out to folks there, said, hey, do you mind if we move him in front? We need to get him in there.
I know it gets a little crazy in the ER and it's busy and people are running around. You're not really getting the answers that you need, but we're here to help and to engage and to make sure that you're very comfortable and you know what's going on.
And so he was first met by our triage nurses, and they actually called me and said, this guy really looks sick. He's in a lot of pain. Can you order a CAT scan for him? We think he might have a kidney stone. I scrolled through his CAT scan, and it was not a kidney stone. And I remember rushing to his room in the emergency department, and his wife was sitting there. And I think she just saw my face like my own, oh no, this is not something straightforward, this is something much worse than a kidney stone.
Based upon her initial evaluation of the CT scan, she saw that Mr. Kennedy was suffering from an acute vascular emergency, something that is called a ruptured abdominal aortic aneurysm. This is a rare diagnosis, and it has an extremely high mortality rate.
I explained to him what the diagnosis was, and they immediately got the sense of the gravity of the diagnosis and how life-threatening this condition can be. And the next step was for me to find a vascular surgeon. She was scrubbed in a procedure, and she said, I think Jim is here. And I said, who's Jim? Let's call Jim. And this, of course, was Dr. James Black, who is the chairman of vascular surgery and just such a renowned, famous surgeon, not just here at Hopkins, but in the whole country, really.
So we've had a vascular surgery presence at Howard County for many, many years. But actually, in this case, for Mr. Kennedy, it was sort of relatively late on Friday. I was finishing clinic, which is a normal thing I do out here, seeing patients with a variety of vascular conditions. And I was called from the emergency department that there was someone down there with a ruptured aneurysm. And in prior iterations of Hopkins medicine, we might have transferred that patient downtown to Johns Hopkins Hospital, but we do vascular surgery here, and we were ready to do the surgery, and we have a great team, so I said, let's not take the risk of transferring someone like Mr. Kennedy and have him potentially rupture the aneurysm worse and not make it. Let's just get it done right now. And so that's what we did. We brought him right to the operating room.
So I knew he was in good hands, and honestly, while I was worried in the surgery, everybody made me feel like it was going to be okay, and they were very optimistic.
In his case, he sailed through everything. He made a very nice recovery. He will have to have monitoring of the rest of his aorta, but he is back to doing the things I know he loves to do, which is to be with his family and exercise even at high levels. And we're keeping an eye on his aorta to make sure the rest of it behaves.
I don't think there are that many people that live to tell this story, and not only live to tell the story, be on their bike and, and thriving.
I cannot imagine a better group of folks than the folks working there, from the person at the front door, all the way through this whole procedure, taking care of me day and night for those 5 days. They are my heroes. I want them to know I'll be back June 26th. My daughter, who recently got married about a year ago, she'll be having our first grandchild at Johns Hopkins, Howard County. And I'm so proud to be able to walk through those halls, because I will be back and I will be looking for people that help me.